Morning students, we have seen regarding scope of health education in the last class up to I think mental health. Next is, so the scope of health education is once again human biology, nutrition, hygiene, family planning and maternal child health, prevention of diseases, prevention of accidents, mental health, utilization of health services, sex education and health status. Okay. Then utilization of health services. Utilization of health services means to inform the community about the health services available and to motivate them for proper use and to inform the voluntary agencies, about the voluntary agencies and motivate the people to participate in the national health programs. And these are also included in areas of health education. Next is sex education. They are getting sexually transmitted infectious diseases, then educating people, especially adolescent people, regarding AIDS and sexual transmitted infections, their prevention. These all included in the while providing health education. Then health statistics. Health statistics to tell the people about importance of birth and death reporting and importance of health surveys. Motivate them to cooperate in these activities. These are also come under the areas of health education. Okay. Then these are the scope of health education. The field of health education is very extensive and connected with every aspect of human life. Then next is planning and evaluation of health education. Planning and evaluation of health education, mainly the facts involved are fixing of targets, know about the problems, know about the community development of implementation of plans and evaluation. Fixing of target means this is for a successful implementation of the health education program. We should plan and evaluate the health education. First, the fixing of targets. That is, targets of health education should be clear, and health problems should be identified on the basis of need or importance of the health and the economic implications. And while setting the targets, it's necessary to have a clear description of the special instructions given to the community. Then their myth should be removed, development of good attitudes in individuals and the required action from individuals and families should be settled. Then to know about the problems. Planning is essential for collecting information about the different aspects of the problem. Mainly important social statistics regarding the problems, affected age group, geographical and environmental factors, collection of information about available and probable health facilities, etc. Then to know about the community. It includes the social and administrative structure of the community, the knowledge of person about the problems, then local traditions, beliefs, superstitious behaviors, the media of communication and their obstacles, then programs conducted in the community and the reaction of the community towards the programs, and the finding about personal and financial resources also. Then development and implementation of plans. This mainly includes the targeted community, the knowledge to be imparted, development of attitudes, then methods to be employed, availability of transport, finding out of the local leadership and getting cooperation of government and voluntary agencies, etc. Then evaluation, continued evaluation of health education program from beginning to end is necessary to find out the success or failure, and necessary changes in the programs can be made on the basis of continuous evaluation. Then this evaluation must be done with regard to the targets, then process and the results, etc. Then next is process of change, that is modification of health behavior and adopting new ideas. That is the education, health education should promote giving up of old habits and accepting new concept, and this is a psychological process. So the main stages while accepting the various facts about health and taking up new ideas. അപ്പോൾ ആളുകൾ പീപ്പിളിൽ ഈ മോഡിഫിക്കേഷൻ ഓഫ് ബിഹേവിയർ ഉണ്ടാകുമ്പോൾ പുതിയ ഹെൽത്ത് ബിഹേവിയേഴ്സ് മോഡിഫൈ ചെയ്യുമ്പോൾ അവർക്ക് ഇത്രയും സ്റ്റേജസിൽ കൂടെ കടന്നു പോകും. ഫസ്റ്റ് ഈസ് അവെയർനെസ്, ദെൻ ഇൻട്രസ്റ്റ്, ഇവാലുവേഷൻ, റിജക്ഷൻ, അക്സെപ്റ്റൻസ്, ട്രയൽ ആൻഡ് അഡാപ്റ്റേഷൻ. Awareness in this stage, people have some information and knowledge about new facts and is familiar with them to some extent. Then interest. This is the second stage of acceptance of new facts, where individual develops interest and eager to know more about the topic. Then the next stage is evaluation. In this level, the people evaluate the possible importance of the new habits on themselves. Then in this stage, it's decided whether the individual will accept or reject the new thinking. Next is rejection. If individual rejects the new thoughts or new behavior, then more awareness needs to be created towards the benefits of new behavior pattern. Then acceptance. After evaluation, they may accept the new thinking and begin to act accordingly on the trial basis. Then trial. In this situation, the individual tries to practice the new habits and thoughts and gives attention to more information and helpful ideas about the concerning subjects. And the last stage is adaptation. Here the individual accepts the new thinking and start practicing the new habits. These are the changes taking place while modifying health behavior, modifying and adopting new ideas. Next is approaches to public health education. That is legal approach, service approach, educational approach, and primary healthcare approach. There are various means and methods there to improve the standards of public health. The four main approaches, first one is legal approach. Legal approach, protection of public health is done by rules and laws. That is, we know there is a statutory warning that smoking is injurious to health, and in public places it should be avoided. So we are controlling it through law, legally controlling. Then, although this is a negative method, it may be effective to great extent. Then Prevention of Food Adulteration Act, ban on like smoking in public places are example of legal approach. Then service approach. In this, health services are made available to the community for protection of public health with the expectation that the individual will, people will utilize them. Then here voluntary agencies have a major role. Then this is a welfare concept approach. People did not respond to it properly because സൊസൈറ്റിയുടെ ഒരു നീഡാണെന്ന് അവർക്കത് ഫീൽ ചെയ്യാത്തത് കൊണ്ട് അത് ശരിക്കും അവരതിന് വേണ്ടിയിട്ട് റെസ്പോണ്ട് ചെയ്യില്ല. ദെൻ educational approach. Educational approach, health education is the most effective tool for the fulfillment of communities' health requirements and achievements of targets, etc. അപ്പോൾ ഇതൊരു പോസിറ്റീവ് ആൻഡ് ഡെമോക്രാറ്റിക് അപ്രോച്ചാണ് എഡ്യൂക്കേഷണൽ അപ്രോച്ച്. by educating the public അവരുടെ തിങ്കിങ് ഓർ ക്യാരക്ടർ ബിഹേവിയർ നമ്മൾ മോഡിഫൈ ചെയ്യുന്നു. Then primary healthcare approach. This approach is a newer approach and based on the principles of primary healthcare related to community involvement and intersectoral coordination. Primary healthcare approach mainly aims at people's full participation, involvement and support in the planning and delivery of healthcare services. So here mainly focus of this approach is to help the individuals to become self-dependent in their health matters. These are the main approaches: legal approach, service approach, educational approach and primary healthcare approach. Next is factors affecting health education. Factors affecting main factors are: first is absence of continuity and repetition. Then unimportant topic for the community. The topic must be according to the need of the community. Then lack of interest towards learning in the individual, lack of motivational drive in the subject. Then the level of health education being beyond the learner's intelligence or complicated subject matter ആണെങ്കിൽ, then lack of changing agents, lack of education and presence of superstitions, then financial difficulties ഉണ്ടെങ്കിൽ, then individual or family problems, lack of audio visual aids in teaching. ഇപ്പോൾ എയ്ഡ്സ് ഒന്നും പ്രോപ്പറായിട്ട് യൂസ് ചെയ്യുന്നില്ല എങ്കിൽ അത് ഒരു ഇൻട്രസ്റ്റ് ഉണ്ടാകത്തില്ല പബ്ലിക്കിന്. ദെൻ മീഡിയം ഓഫ് ഇൻസ്ട്രക്ഷൻസ് ഇൻ ഹെൽത്ത് എഡ്യൂക്കേഷൻ അതൊരു ഇമ്പോർട്ടൻറ്റ് ഫാക്ടറാണ്. ദെൻ ഇൻഡിവിജ്വൽ കപ്പാസിറ്റി ഓഫ് ദ ഹെൽത്ത് എഡ്യൂക്കേറ്റർ, ദെൻ ഇഗ്നോറിംഗ് ലോക്കൽ സപ്പോർട്ട്, ignoring the realities connected with the special groups and community in the area, lack of correct planning of resources and improper evaluation. ഈ ഫാക്ടേഴ്സ് എല്ലാം ഹെൽത്ത് എഡ്യൂക്കേഷൻ്റെ ഇഫക്റ്റീവ്നെസ്സിനെ അഫക്റ്റ് ചെയ്യുക. നെക്സ്റ്റ് ഈസ് സ്റ്റേജസ് ഓഫ് ഹെൽത്ത് എഡ്യൂക്കേഷൻ. We know health education is very much important for every age group and general public. And it can be given into the community, to the school, to the family, on individual basis. Everywhere we can give health education. And based on the target groups, there are mainly three main levels of health education. That is individual or family level, group level and general public level. Individual or family level, we know the target of health education is an individual or the family. In this level, health education is imparted or knowledge is imparted to a limited number of people with a limited reference. Then, so that the number of persons is limited, so the health education can be effective also. Then, the doctors, nurses, health workers, ഇവരെല്ലാവരുമാണ് ഹെൽത്ത് എഡ്യൂക്കേഷൻ കോൺട്രിബ്യൂഷന് വേണ്ടിയിട്ട് നമ്മൾ റിസോഴ്സ് പേഴ്സണായിട്ട് യൂസ് ചെയ്യുന്നത്. ദെൻ ഇൻ ഇൻഡിവിജ്വൽ ഹെൽത്ത് എഡ്യൂക്കേഷൻ എക്സ്ചേഞ്ച് ഓഫ് തോട്ട്സ്, ഡൗട്ട് ക്ലിയറൻസ്, ദെൻ ഇൻഡിവിജ്വൽ ക്യാൻ ബി മോട്ടിവേറ്റഡ് ടു ചേഞ്ച് ഹിസ് ഓർ ഹർ ബിഹേവിയർ. ദെൻ ഗ്രൂപ്പ് ലെവൽ it can be a particular group, that is school students, youth, mothers, Anganwadi mothers, workers, elderly people, patients, in any class of the society can be selected for a particular group. We are giving education to a particular group. Then it should be chosen according to the needs and taste of the group. Otherwise, the whole effort of the health education will be useless or meaningless. Then general public level health education, the health message is conveyed to the community and not towards any individual or group directly. Then for example, in case of personal hygiene, importance of washing hands is the target topic of common people. Here still in this method there are some